Welcome to our presentation on the PurElsa Kaha Booster. This cutting-edge technology is designed to provide comprehensive anti-aging solutions across superficial skin layers. PurElsa, derived from PurElsa, is like the flawless pearl on a crown, the Snow Queen in her purest form. It represents a new generation of regenerative art, carrying immense energy within its unique CAHA microspheres. As these microspheres gradually degrade, the chelated calcium released irrigates and nourishes every corner of the skin, playing an immensely positive role in strengthening our skin barrier. We all adore Audrey Hepburn, the eternal princess in our hearts. Her skin, as delicate and luminous as pearls adorning a crown, made her the perfect embodiment of PurElsa's essence. First, let's talk about what constitutes a new generation of medical products for skin's anti-aging in regenerative and natural way. The 1.0 era of mesotherapy primarily addressed skin hydration and nutrient supplementation, with typical products including hyaluronic acid and various hyaluronic acid-based cocktails of nutrients, even pharmaceutical ingredients, commonly referred to as cocktail therapy. With the evolution of concepts and advancements in technology, we have now entered the 2.0 era of mesotherapy. Key products include collagen-based formulations that passively replenish the skin's collagen supply, as well as PurElsa boosters, often known as collagen stimulators, that actively stimulate the regeneration of collagen in the superficial layers of the skin. Together, these solutions work both actively and passively to provide the essential collagen needed for firmer, more lifted skin. As we know, the iceberg theory tells us that only 10% is visible above the surface, while 90% remains unseen beneath. The same, skin anti-aging is far more than simply replenishing moisture and nutrients on the surface. It's about addressing the root cause. We are fortunate to have entered the 3.0 era of superficial skin anti-aging. Biostimulation, skin barrier repair, improving skin structural quality, and preventing nutrient loss. Through those, we can achieve long-term, effective anti-aging, truly solving the 90% of unseen concerns. This is exactly the breakthrough that PurElsa Kaha Booster brings to us. As a globally recognized and extensively utilized biomaterial for skin rejuvenation, calcium hydroxyapatite has garnered widespread acclaim for its remarkable efficacy. Among the nearly 2,900 academic publications in 2023 alone, 132 were dedicated to exploring its applications in facial rejuvenation, further solidifying its prominence in the field. Calcium hydroxyapatite is a truly non-inflammatory regenerative biomaterial. Here, we present a brief comparison between CAHA and PurElsa. As shown in the table, their target cells differ. CAHA primarily acts on fibroblasts and keratinocytes, while PurElsa mainly influences stem cells and macrophages. Additionally, the duration of collagen stimulation varies between them. CAHA promotes immediate collagen regeneration, whereas PurElsa stimulates collagen production gradually, often requiring multiple treatments to achieve visible results. Furthermore, CAHA demonstrates stronger angiogenic effects compared to PurElsa. In terms of regenerative mechanisms, CAHA operates through mechanical regeneration, and the degradation of CAHA microspheres does not alter the skin's pH level. In contrast, PurElsa relies on inflammatory regeneration, and the degradation of PurElsa microspheres leads to a mildly acidic environment in the skin. Here, I am honored to introduce PurElsa Kaha Booster, a globally unique skin rejuvenation product with nano to micron level, designed to act from the superficial dermis to the epidermis, effectively increasing epidermal thickness and enhancing skin barrier function. First, PurElsa features uniformly spherical microspheres with a particle size of 2–10 micrometers, whereas PLLA appears as irregular flakes or spheres measuring 20–30 micrometers. Other superdiluted KAHA or PCL products typically range from 30–50 micrometers. Particle size determines the depth and position at which these microspheres can effectively integrate. While PCL or other KAHA products are limited to the supraperiosteal layer or deep dermis, and PLLA is injected into the superficial fat layer, but PurElsa acts directly on the superficial dermis and even the epidermal layer. Moreover, PLLA, PCL, and other KAHA products consist of solid microspheres, while PurElsa contains a uniquely micro-rough surface with through-hole pores, offering exceptional biocompatibility. Its degradation is controllable and completes within 3 to 6 months, no residue, effectively avoiding risks such as nodules, granulomas, and delayed onset swelling. PurElsa KAHA Booster Series primarily consists of 2 products, PurElsa KAHA Booster 8 and PurElsa KAHA Booster 6. PurElsa KAHA Booster 8 is mainly composed of 1% patented KAHA microspheres and a patented modified polysaccharide cellulose, with a primary content of 50 mg 5 ml. Designed for significantly aged skin, at professional medical clinics, it is typically administered once every 1 to 2 months. This formulation effectively minimizes pores, reduces fine lines around the eyes, and enhances the skin's barrier function. It is suitable for individuals aged 30 to 65. Before use, the product must be shaken well to ensure even distribution of the microspheres in the solution. Please follow the instructions and medical advice provided. PurElsa KAHA Booster 6 is primarily composed of gradient-modified polysaccharide cellulose and 0.8% patented KAHA microspheres, with a main ingredient concentration of 35 mg 5 ml. Designed for younger or more sensitive skin, at professional medical clinics, this product is typically administered once every 1 to 2 months. It effectively reduces inflammation, naturally brightens and whitens the skin, and promotes healthier skin barriers. It's suitable for aged 25 to 45. Before use, it must be shaken well to ensure even distribution of microspheres in the solution. Please follow the instructions and medical advice provided. Now let's turn our focus to the remarkable CHA microspheres of PurElsa. PurElsa's unique magic, patented KAHA microspheres. As revealed in the electron microscope images, our KAHA microspheres possess 3 major advantages. First, the microspheres are evenly distributed within the polysaccharide cellulose composite solution, reducing inflammatory responses and ensuring enhanced safety. Second, the microspheres feature a raspberry-like microtextured surface, which significantly improves cell adhesion and facilitates the anchoring of newly formed collagen. Third, the topologically through-hole structure of the microspheres allows controllable degradation within 3 to 6 months, substantially minimizing the risks of nodules, granulomas, and delayed swelling. PurElsa's KAHA microspheres are further distinguished by 3 patented innovations. First, a topologically through-hole structure, composed of hundreds of millions of nanoscale microspheres coalesced into a single 2–10-micron KAHA microsphere. In contrast, other KAHA products are manufactured through high-temperature sintering and grinding processes, resulting in solid microspheres. This uniquely porous architecture allows precise control over porosity and degradation rate, enabling complete degradation within 3 to 6 months. Second, a patented defect site structure on the molecular surface of the microspheres. These defect sites effectively capture free radicals within the skin, protecting cells from oxidation and slowing the aging process of healthy skin cells. PurElsa holds the exclusive global patent rights for this technology. Third, a raspberry-like microrough surface that significantly enhances cell adhesion and promotes the anchoring of newly formed collagen fibers. This article provides a detailed account of the patented technology concerning the defect site structure of PurElsa Kaha microspheres. As illustrated in the figure, PurElsa's magical Kaha microspheres exert a unique non-inflammatory regenerative effect within the skin through a dual mechanism of stimulating collagen regeneration and gradually releasing calcium ions. Firstly, uniform in size and shape, these suspended microspheres are injected into the superficial dermis and epidermal layers of the skin, where they attract fibroblasts and keratinocytes, promoting the organized regeneration of the extracellular matrix. Through a non-inflammatory regenerative process, they continuously stimulate the production of new collagen and elastic fibers. Meanwhile, the microspheres release calcium ions over time, which then combine with modified polysaccharide cellulose to form polysaccharide chelated calcium. This compound is readily absorbed by all layers of the skin, contributing effectively to the strengthening of the skin barrier. PurElsa's second exclusive magic, patently modified polysaccharide cellulose (CMC). Our polysaccharide cellulose shares the same structural composition as deep-sea squirts, making it one of the most water-retentive polysaccharide materials known to date. According to literature reports, physically cross-linked polysaccharide gels can retain up to 5,000 times their own weight in water, while chemically cross-linked hyaluronic acid typically retains between 800 to 1,000 times its weight. It can thus be said that the moisture-locking and hydrating performance of cross-linked polysaccharide cellulose, CMC, far surpasses that of cross-linked hyaluronic acid. How should we understand the modified polysaccharide cellulose? Our patented technology enables the introduction of sulfhydryl groups onto specific sites of polysaccharide cellulose, resulting in modified polysaccharide cellulose. Though a seemingly subtle modification, it significantly enhances both natural brightening and antibacterial efficacy from the roots. This is the validation experiment we conducted to assess the natural antibacterial effect of modified polysaccharide cellulose. In the left image, location 1 is the control, while locations 2, 3, and 4 were treated with the modified polysaccharide cellulose solution. Clearly defined zones of inhibition can be observed around locations 2, 3, and 4. The right figure shows the growth inhibition test against Staphylococcus aureus for both the control and the sample. As illustrated in the curve, over time, the sample group demonstrates a significant inhibitory effect on the growth of Staphylococcus aureus. This chart illustrates the theoretical mechanism behind how modified polysaccharide cellulose achieves fundamental whitening effects. It works by inhibiting the synthesis of tyrosinase, thereby reducing the excessive production and accumulation of melanin. This endogenous whitening mechanism does not rely on external whitening ingredients, resulting in a natural, long-lasting brightening effect without causing skin irritation. PurElsa, like a pearl upon a crown, awaits to bestow beauty with its grace. To date, We have secured more than 14 patents both in China and internationally, alongside over 11 preclinical biosafety reports. All of these efforts are dedicated to ensuring safe, natural beauty and graceful rejuvenation. With comprehensive biosafety reports, we have conducted pre-market clinical trials at the top 4 dermatology hospitals in China. Based on rigorous research and strict control of the degradation performance of PurElsa, we have also completed 100% full degradation tests in an FDA-approved laboratory, with corresponding test reports issued. PurElsa is currently the only skin rejuvenation product for superficial layers that comes with experimental certification of complete biodegradability. PurElsa Kaha Booster stands out with the following key advantages. First, it is the result of years of research and development at advanced R&D centers. The production facility meets international ISO standards, ensuring that each product undergoes rigorous manufacturing processes and reaches consumers with consistent quality. Second, it features the world's only patented Kaha microspheres specifically designed for superficial skin rejuvenation. With a particle size of 2 to 10 microns, these microspheres effectively target both the superficial dermis and the epidermis. The uniquely modified polysaccharide cellulose offers natural brightening and antibacterial benefits. Third, the product is formulated with a single, highly pure pharmaceutical-grade and biosafe ingredients, ensuring exceptional biocompatibility. It is suitable for various skin conditions in superficial anti-aging treatments, causing no pain, no swelling, low inflammation, and few nodule formation. No residue. Based on our thorough understanding of PurElsa's research journey and scientific data, and building upon its 2 core patented ingredients, we have introduced PCCT, polysaccharide chelated calcium therapy. This innovative approach enhances skin barrier function, making it stronger and more resilient than ever. It is widely recognized by dermatologists that the damage of the skin barrier can accelerate skin aging. In the early stages of the rising popularity of mesotherapy treatment, the passive injection of hyaluronic acid and various nutrients may temporarily improve the skin's external quality, such as enhancing brightness and radiance. However, with excessive treatments, the skin condition tends to deteriorate more rapidly, accompanied by the disruption of the stratum corneum, thinning skin, increased sensitivity, and issues such as persistent facial redness. As illustrated in the left figure, transcriptomic studies reveal that as the skin ages, the thickness of the epidermis, the integrity of the dermal-epidermal junction, and the density of collagen progressively decline. Within the epidermal layer, the proliferative capacities of keratinocytes weaken, leading to epidermal thinning and the effacement or narrowing of the dermoepidermal junction. In the dermal layer, collagen synthesis diminishes, while existing collagen fibers fracture, fragment, and become disorganized in structure. All these findings demonstrate that skin aging, from the dermis to the epidermis, is intimately linked to the integrity of the skin barrier. According to the latest market research in the beauty industry, barrier repair has surpassed anti-aging as the most prominent keyword among consumers today. Moreover, consumers are increasingly willing to spend more on products dedicated to barrier healthy. In a market research report, among the respondents, 37% had a deep understanding of damaged skin barrier. However, there are still many consumers who need to enhance their understanding of barrier healthy and thus generate demand. In daily life, many situations can easily cause skin problems. Among them, seasonal changes, sunburn and outdoor activities, and peeling medical treatment are the scenarios with the highest correlation to barrier problem. Compared to addressing other skin concerns, consumers tend to place greater trust in professional dermatologists when it comes to repairing the skin barrier. After all, restoring the skin barrier requires highly specialized testing and targeted treatment, along with a significant investment of time and patience. It is not a process that can be rushed. Once compromised, the skin barrier can significantly accelerate the loss of essential nutrients, leading to rapid skin aging. Among all treatment approaches, regenerating the skin barrier represents the ultimate goal. As illustrated in the pyramid of skin treatment needs, the most fundamental requirements include cleansing, moisturizing, and UV protection. Intermediate needs involve nutritional repair and anti-inflammation, such as the use of anti-inflammatory and antibacterial products, PDRN, niacinamide, or direct collagen supplementation. The highest level goal, however, is the regeneration of the skin barrier to naturally restore its normal physiological functions. This is where PurElsa Kaha Booster becomes indispensable. PurElsa Kaha Booster, the crown jewel of skin barrier regeneration. When it comes to skin barrier regeneration, we cannot overlook the profound significance of calcium ions. As noted by Professor Maybach of the University of California School of Medicine in his research paper, calcium ions are instrumental in maintaining the homeostasis of the skin barrier. Any alteration in the barrier integrity can disrupt the calcium ion gradient within the skin, thereby impairing the process of skin barrier regeneration. Within the skin, the distribution of bioavailable calcium ions follows a remarkably unique pattern. In the granular layer, calcium ion concentration peaks, effectively preventing nutrient loss. From the stratum corneum outward, this concentration declines sharply, yet it gradually increases again as the cuticle continues to move further out. Across the epidermal layers, calcium ions exhibit a distinct T-shaped gradient, lowest in the basal layer and progressively rising toward the stratum corneum. However, this characteristic distribution is visibly lost in aged or damaged skin. Calcium ions concentration affects intercellular adhesion and cell differentiation. High calcium concentration in extracellular can also induce cadherin to rapidly aggregate at the site of intercellular adhesion junctions. With the increase of intracellular calcium concentration, the cell differentiation will be promoted and the expression of desmosome will be enhanced, and the latter clung to the keratin intermediate filament network to form desmosomes. Calcium ions induce keratinocytes differentiation, proliferation, keratotheca formation, epidermal lipid synthesis. The key to form a stronger skin barrier. Low extracellular calcium concentration promotes keratinocyte proliferation. High calcium concentration promotes keratinocyte differentiation. Calcium ions play a regulatory role in modulating the functions of all four layers of the skin barrier, the physical, immune, chemical, and microbial barriers. It is attributed to the third magic of PurElsa, PCCT, modified polysaccharide chelated calcium therapy. Because as our patented Kaha microspheres degrade, they gradually release calcium ions. These calcium ions then chelate with modified polysaccharide cellulose to form polysaccharide chelated calcium, which demonstrates significantly higher absorption efficiency in the human body compared to ordinary biological calcium. Experimental data indicates that in the weakly acidic environment of the skin, the absorption of chelated calcium ions could increase by 41%. As opposed to free calcium ions, the chelated formation can greatly improve the bioavailability of calcium. Through experimental data, it has been demonstrated that with monthly application of PurElsa Kaha Booster, over 6 months of regular use, it significantly improves skin thickness and tolerance, as confirmed by clinical ultrasound imaging. As shown in the images below, the skin structure transitions from a disorganized dermis and a relatively thin epidermis to a visibly ordered, firm dermal layer and a thickened epidermis after treatment. Now, let's take a look at the 2 clinical cases. We call PurElsa Kaha Booster the magic vials, because its 2 core ingredients miraculously deliver 6 magical benefits. Although it contains only 2 patented components, Kaha microspheres and modified polysaccharide cellulose, it offers exceptional moisturizing and hydrating properties, a skin brightening and whitening effect, endogenous antibacterial action, and stimulates collagen regeneration in the superficial dermis. It truly promotes skin barrier renewal, enhancing the skin's natural barrier function in a long, effective way. Here, we have provided a comparative analysis of PurElsa Kaha Booster against other Kaha and PLLA-based products for superficial skin rejuvenation. We invite you to review the details above at your convenience. Should you have any questions, please feel free to leave a message or contact us directly. Thank you. The Enchantment of PurElsa, a guide to its magical application. This table provides a detailed overview of the thickness of the dermal and epidermal layers across various areas of the human body, offering physicians clear guidance on the optimal injection depth for different regions. Additionally, it outlines the recommended frequency and intervals for treatments using PurElsa Kaha Booster 8 and PurElsa Kaha Booster 6, tailored to different age groups. Please remember to shake the product well as instructed in the manual before use, and avoid application on the lip area whenever possible. After the treatment, please strictly adhere to the post-procedure care guidelines. Should adverse reactions such as redness, swelling, or nodules occur, follow our instructions immediately and report the situation. Please remember that proper preoperative cleansing and disinfection can significantly reduce the risk of infection. It is essential for physicians to conduct a thorough preoperative assessment of the patient's skin condition and formulate an appropriate treatment plan. Using PurElsa Kaha Booster in a compliant and lawful manner represents the most fundamental respect for the patient. Based on our clinical experience, PurElsa Kaha Booster delivers synergistic results, achieving a remarkable effect when used in combination with the following categories of radiofrequency and laser devices. Highly recommended for integrated application. Thank you all for your kind attention.